Whenever we discuss any type of technology in healthcare, we always say that the biggest challenge facing its implementation is data privacy and data security, which is a concern for different fields, not only healthcare, but healthcare because it's a very regulated environment. So patient confidentiality and data privacy is very, very important. So the main obstacle in front of big organizations in healthcare to implement advanced technology like artificial intelligence, machine learning, and big data, data analytics, and telemedicine is data confidentiality and security. We also mentioned different times when we discussed the big data and data analytics, telemedicine, that there are new type of technologies that are providing solutions to protect big data and to ensure its security and confidentiality. And this type of technologies are called blockchain technology. And blockchain technology is not the easiest to explain, but I promise that I will simplify it and explain it so your 12-year-old child would understand it. I promise you so. So let's get started. Let's remember that we are users of the technology. We are not going to do any programming or do any softwares to facilitate using it. We need only to understand the concept, how it can help us, and then we need some training and some information on how to use it in our daily practice. So I will share with you my understanding of the blockchain technology. We cannot store big data like electronic health records or similar big size, very big size data on traditional computers. So this is the first advantage that blockchain technology provides. So it stores information on different computers. These computers are called nodes, or call them blocks of information. Each block of information is connected to another one in a sequence. So each block, whenever you fill it with information, it is locked. You cannot change it anymore, and it is linked with the next block. So all the blocks are connected together and they are linked together, and each single block has a copy of all the chain or all the blocks. So whenever any block is not working, the whole system will still have a backup of this block and a backup of the entire blocks or the entire system. So you cannot add any new block unless all the blocks agree and approve, or all the people controlling the other blocks agree and approve. So there are certain conditions, predefined conditions, to ensure that you are following them in order to add information. So adding information or modifying information is not for anyone. If you want to add or access the information, you have to be one of those who have access. So the other point about blockchain technology is that if any computer is damaged or crashed, still there is a copy in the other blocks of the entire information. So you don't lose the information. You cannot delete any block. A super secured system that can hold a huge volume of data, regardless the type of this data, whether it is structured, unstructured, or semi-structured. And it is super secured. So no one can change it, no one can delete it, and only certain people who have access can add new information after the consensus of all the parties involved. Let's watch this short video. It will help us also to understand the concept, and then we will see how can it protect the healthcare data, for example, or the electronic health records.
Blockchain is like a digital ledger, just like a notebook for recording transactions. But instead of one person holding the notebook, many people have copies of it. Each page in this notebook is called a block. When a page is full, it gets locked and linked to the next page, forming a chain. This makes it a blockchain. The cool thing is, once a page is written and locked, it can't be changed. This keeps the information safe and trustworthy. Blockchain is decentralized, meaning no single person controls it. Instead, many computers around the world share the control. This makes it more secure because it's hard to hack into many computers at once. Transactions on a blockchain are verified by many people. They all must agree that the transaction is valid before it's added to the chain. This agreement process is called consensus. Blockchain uses strong encryption to protect data. This means only authorized people can see the information. In healthcare, blockchain can securely store patient records, track medicine, and ensure data privacy. It makes sharing medical information safer and more reliable. So, in simple terms, blockchain is a secure, shared notebook that many people can trust. It keeps our data safe and helps us work together more efficiently.
Now that we know that the blockchain technology is a super secured system, I think this gives us assurance that any data that will be stored in such a system will be secured. The second question we need to know, because we are interested to know, how it protects the data. What are the mechanisms by which this technology protects the data to give us more assurance that we are going to have our data, especially healthcare data, on long-term basis, very well kept and secure. The technology uses 8 types of techniques to protect the data. For us, it is good to know the names of these techniques and to understand what we mean when we mention, for example, consensus mechanism. And when we say something like secured contracts or smart contracts, what do we exactly mean when we mention these terminologies? These are the mechanisms by which blockchain technology protects data, big data. So let's know them. But I don't think that we need to go into the details of each mechanism and into the sophistications of how it enables the computers to do this job. All what we need as healthcare professionals or pharmaceutical professionals is to understand the mechanisms. And this will complement the concept. And the next stage will be, okay, how can we utilize this in clinical practice or in our work in the pharmaceutical industry?
Blockchain technology offers a powerful solution for protecting the privacy and confidentiality of big data. Let's explore 8 key techniques it uses to achieve this. First, blockchain employs decentralized storage. Instead of storing data in one place, it distributes copies across multiple nodes. This minimizes the risk of a single point of failure, enhancing security. Second, strong encryption secures the data. Only authorized users can decrypt and access the information, ensuring that it remains private and confidential. Third, blockchain creates immutable records. Once data is added, it cannot be changed or deleted. Each record is linked to the previous one, forming a secure chain that makes tampering nearly impossible. Fourth, access control is a critical feature. Blockchain allows precise control over who can access the data. Permissions can be set for different users, ensuring that only authorized individuals can view or modify specific data. Fifth, the consensus mechanism adds an extra layer of protection. Any changes to the blockchain require agreement from the majority of nodes. This prevents unauthorized modifications and ensures all data changes are legitimate. Sixth, blockchain can anonymize data by using unique identifiers. Personal information is not directly exposed, protecting the identities of individuals in the data. Seventh, auditability is built into the system. Every transaction is recorded and time-stamped, creating a transparent and traceable history of data access and changes. This helps in detecting and investigating any unauthorized access. Finally, smart contracts enforce privacy rules automatically. These automated agreements ensure that data is shared only according to predefined conditions, adding an extra layer of security to data handling. By combining these 8 techniques, blockchain technology provides robust protection for the privacy and confidentiality of big data. It ensures that sensitive information is secure, tamper-proof, and accessible only to authorized users.
Now let's see how can we use blockchain technology to protect the data that we use in healthcare systems. So discussing the uses of blockchain technology in healthcare, I have categorized this into 10 categories. But of course, there is no limit as long as data security and confidentiality is in question. I think blockchain technology is a very good solution. So, the first and the most important use is in electronic medical records management, where this technology can secure and provide unified storage for different patient records. It also ensures data integrity and easy access for any authorized medical personnel. And in addition to this, it facilitates seamless data sharing across different healthcare providers. The second important use is patient consent management. And this is part of the usage of blockchain technology in clinical trials because this technology automates and secures the process of obtaining patient consent so it makes it easier for investigators. It also ensures that patient consent records are tamper proofed and easily verifiable. Also, it enhances the transparency in how the patient data is used and utilized. The third category is about the supply management, where this technology provides tracking of different pharmaceuticals from the manufacturer side to the delivery. It ensures how authentic this drug is and the quality of its manufacturing. And it also reduces the risk of the counterfeit medication entering any market. The fourth category is related to clinical research, and here we need to understand that blockchain technology can enhance the transparency and trust in clinical trial data, and this is a big value because it improves how we can trace the results and the data integrity, and also it facilitates the security and efficiency when it comes to recruitment and monitoring of trial participants. The fifth category is related to health data exchange, where the technology enables secure and efficient sharing of health data between different health systems or organizations. And this would enhance how IT systems integrate together and work together. Of course, this would protect the patient privacy while allowing data to be used for research and analysis. Number six is the insurance claims and the insurance sector in general. So the technology can automate and streamline the insurance chain submissions and processing. It can reduce the fraud by ensuring how authentic the claims are. And also it can speed up the reimbursement process for patients and for providers. One of the most important areas that blockchain technology can be utilized in is genomics, because the technology provides a secure platform for storing and sharing genomic data. While it ensures the privacy of genetic information, it can also facilitate research by enabling secure and transparent sharing. We discussed before telemedicine and the concerns about it. So, here, this technology can secure patient doctor interactions and all the medical data in telemedicine platforms. It also can ensure how private and integral the consultation and diagnosis, and enhancing also the trust in the services. And this will build the trust of the patients in the online telemedicine interactions. Number nine is the drug development, where the technology can be used to track and secure data throughout the drug development life cycle, ensuring the collaboration and data sharing among different research organizations, and also ensuring compliance with regulatory standards. The last point I would mention here is public health surveillance. Whenever there is surveillance, in order to enhance the collection and the analysis of public health data, this is the solution. Ensuring accuracy and integrity of the epidemiological data, while facilitating real-time tracking and response to public health threats. In summary, the blockchain technology offers numerous applications in healthcare, from managing medical records and patient consent to enhancing drug supply, security, and improving the outcomes of clinical trials. Its ability to secure data and ensure transparency while streamlining processes makes it a very strong and valuable tool for addressing various challenges in the healthcare industry. I have no idea how costly this technology is, but I think at least we can consider that data security should not be an obstacle for any healthcare system to adopt advanced technology. That's what I wanted to share with you today, blockchain technology. I hope I made it as simple as possible. Thank you very much for your attention and see you in the next tutorial.